public health is really, in my view, it's making sure that we're working towards that we're boosting everyone up to have the opportunity to live the healthiest life possible. And epidemiology is the science of how we do that.
Hi, Eric. Welcome to the podcast. How are you?
Hi, Dr. Huntley. I'm good. Thank you for having me on the podcast.
I'm happy to have you here. And I want to dive into our conversation. We've been chatting for a little bit, getting kind of set up and ready for the recording. So I am looking forward to this. So let's jump in. Let's start with you telling everyone a little bit about yourself.
So my name is Erik Ohlrogge. I am a program director at the Great Lakes Intertribal Epidemiology Center. Most people call it GLITEC, based on its acronym. I get the opportunity to work with a bunch of really incredible diverse communities in the Great Lakes region, working on public health and epidemiology projects. For example, I get to work on a variety of environmental health projects. We're trying to get PFAS testing and drinking water program started. We have a blend testing program as well. We work on vaccine communication, a bunch of different epidemiology things as well, including data linkages, trying to promote better public health data for American Indians and Alaska Natives. So really a bunch of really incredible projects with a bunch of incredible people. And that's kind of what I do now. I can talk a little bit about how I came to the Great Lakes Intertribal Epidemiology Center. I don't know.
Yeah, no, this is perfect. This is because my first question or next question is that let's kind of go kind of back a little bit and work our way up to how you got to where you are now. So I'd love to hear how, when did you first learn about public health and become interested in public health as a career?
Yeah, I think I kind of fell into public health actually, and I just had a bunch of really incredible mentors and then people in my life who sort of ended up nudging me towards public health. Really early on in high school in my bachelor's, I hadn't really heard of public health. I didn't really know it was a thing. I didn't really know what public health did. And initially, I'd wanted to become a doctor. My dad's a family practice doctor, and I always thought that that would be in the cards for me. And then I just, through a bunch of different experiences, courses, and projects that I worked on, I kind of started to emphasize prevention predominantly over treatment, which I thought was really fascinating because then there are all these intersecting like systems, policies, ways of approaching healthcare that I hadn't really considered. And then a couple mentors in my bachelor's nudged me to look beyond medical school at, like a public health or global health type program. And I actually ended up applying to a global health program. It's based out of the Netherlands, which was absolutely fascinating and eye opening. And it really helped me learn a lot about how there are these prevention focused ways of approaching healthcare and how that can be so much more beneficial than these treatment focused approaches that we often have. And then also like how things like colonialism on top of all of that affect the systems which we live in. And I thought that was really fascinating. Yeah. Bunch of incredible mentors and then just lucky opportunities and experiences led me here.
Yeah, I can relate to that. I know for myself, I started out pre-med and a lot of us did as I, talk to folks on the podcast. And then there's this point where we learn about either for you it's the prevention, the attraction to the prevention model. And for me, it was the population, I can really treat or not treat, but impact and help populations of people at a time as opposed to one at a time. So a lot of us were converted or diverted off, that path and kind of found what we really were looking for. I just didn't know that it was a thing. So yeah, it's
Yeah.
really interesting to hear people's journey at that point.
Yeah, it's amazing how there are through lines like this, right? It's the like one of the through lines that I oftentimes see is just this exposure, right? I mean, it's don't really know it exists or it's out there, and then people come to this idea and then end up discovering public health via to focus on the population or prevention, what have you.
hmm So you said something interesting about the, sort of the sounds like you had an introduction to some of the challenges that tribal populations face early on in education. So how did you end up working at the Tribal Epidemiology Center?
Yeah, that's a really good question. Again, kind of through a combination of like really incredible mentors that I've had in my life and then also just lucky life experiences. I graduated from my master's right before the COVID COVID-19 pandemic. I graduated with a Master's of Science in Global Health. We did research, internship, immersion experiences for our masters. We had two of them. One of them was it focused on fishing and traditional systems of like food gathering in Greenland and how that intersects with public health and all these international systems. It was absolutely fascinating. And through that, I was connected with my thesis advisor, who I worked with on social determinants of health in remote Northern Ontario flying communities. So they have really unique people who live in these communities have like a really unique context that they live in, and it's influenced by really unique like policy context as well and like historical context because they're predominantly First Nations communities. There's like a lot of opportunity for growth and for doing things better in response to community needs. And I did my thesis on sort of that whole system. Graduated, COVID-19 happened, and then sort of found myself back home in Wisconsin in the middle of the pandemic, just trying to figure out what I can do. And then I ended up getting a job with the Wisconsin Department of Health Services to work on the COVID response team task force. And I became a team lead for our contact tracing efforts. And then I learned a lot through there. And through that, I was connected to a person who had done this thing called the Wisconsin Population Health Service Fellowship, which is a 2-year fellowship. It connects young public health professionals with different organizations within the state of Wisconsin to try and focus on health equity and equitable health outcomes. And like the fellowship is absolutely fantastic. Like I can't say enough positive things about it. And the people who I've been connected with through the fellowship. But essentially the fellowship placed me at the Great Lakes Intertribal Epidemiology Center, and I was a fellow for there a little while. Then I ended up applying to a job here, and that's how I came to be here.
I think that's great. Great story, great journey, because a lot of this is sort of circumstance. Like you said, a lot of things played factors and played into this. But I'm really glad to hear how you did get here because it sounds like a lot of your education was preparing you for this type of work. So it's a great fit. It's a
Yeah,
unique set of skills needed for the work with tribal populations, I think.
very much so. Yeah, definitely like community driven, community focus is really important. And then, just communication, empathy, like just being like humility as well,
Yeah,
being able to
yeah.
admit, I'm wrong and step back and realize for a lot of things I'm not really the expert in the room, right? So really good skill set. A lot of cool experiences that have helped me develop that. So I'm lucky.
Yeah. Yeah, yeah. Let's talk a little bit more about what you currently are doing. Can you describe more about your work day to day and more about the specifics of what you're responsible for?
Yeah. So my current role is the Indian Health Service Cooperative Epidemiology Cooperative Agreement Program Director, which I think is like I get a lot of opportunities to do really fascinating things with fascinating people. How do I describe my day-to-day role? A lot of meetings. No. Predominantly, I help lead and coordinate projects and facilitate people who I work with, facilitate their work on these projects. So, a couple of examples would be we are working on these oversamples for this thing called the Basic Screening Survey. So, we're working on these oversamples in Wisconsin and Minnesota. Oftentimes, there isn't enough high quality data for populations that make up a small proportion of the total
Hmm.
population in the United States. So, American Indians and Alaska Natives are one of those populations that there tends to not be enough high quality data and information to make effective, equitable decisions to promote the health of American Indian Alaska Native communities. So, oversamples are one way to approach that challenge. So, basically, what we do is for schools that have a high proportion of American Indian Alaska Native students, we oversample those schools. So we basically do more samples in those schools so that we make sure that we have enough, statistical power to have effective, high quality results. I'm kind of rambling right now with this.
No, you're
But basically,
good.
I get to work on a bunch of really interesting projects that helps promote the health of American Indians and Alaska Natives and increase the available public health data. And I'm happy to go into other examples too if you want me to.
Yeah,
Or
yeah. No, feel free. This is good. It's just to get a real good sense of kind of what you do. You know, you don't have to worry about the nitty gritty when I say day to day, but just to really get an understanding of what you do. Yeah.
I struggle too because like some things I'm like, how much context should I give? You know, like the whole question of data and high quality data for underserved populations is huge and a massive rabbit hole.
Yeah, I was going to tell you, don't worry if you feel like that's a rabbit hole, because
Yeah,
that has sparked. We have had so many conversations. It has sparked several separate conversations on podcast episodes here just around that. So don't feel that that's everyone struggles there, because it's hard to. You don't want to lightly mention it because it's such a big, heavy topic, but it's hard to go too far without going too far. So I definitely
yeah.
understand how you feel about that. It's an important one. You don't want to just brush over it, but it's a we can say, as far as this podcast goes and this topic, it's an established challenge and ongoing issue that is addressed with every single tech that every person I've talked to in all these episodes with the tech organizations, and it's definitely raised awareness of the challenge and also the creative ways that everyone's trying to address unique and creative ways from organization to organization, location to location is a little different, but the fact that it's being addressed and it's being talked about is important. But yeah, definitely it is hard to not go too far down the rabbit trail on it. Tell me a bit.
Let's mention this topic.
Yeah.
Oh, go ahead.
Tell
Sorry.
me about the population. The for where you work, is there a specific tribe, probably several tribes, but is there, tell us a bit about the population, and then also if there is a specific challenge or focus that you're, right there in Great Lakes that you guys are focused on. Let's talk a bit about that.
Yeah. So we serve 34 tribal nations and then 4 urban Indian organizations within Michigan, Minnesota, Wisconsin, and Chicago. So we serve a huge diversity of people, which is, really pretty incredible. And also, we don't necessarily have one focus because we're predominantly community driven and community focused organization that we're responsive to what community needs are. So predominantly as an organization, we do this thing called technical assistance, which we, if communities reach out and ask us for assistance conducting, for example, community health, we can do that. And really just being responsive to community needs and seeing how we can support them. That's kind of our main focus. And so for the population, we serve American Indians and Alaska Natives in the Great Lakes region. So these 3 states and Chicago. And yeah, does that answer your question? I can talk some
Yeah.
more about some of the root challenges too, if you'd like.
Yeah. Yeah. Please do.
I think root causes of health inequities and challenges, there's like systems are oftentimes at the root of a lot of these inequities and challenges and such. And oftentimes it's the way to solve this is making sure that we're boosting up and really increasing like the power to influence decisions of those most impacted by a lot of what some people call health challenges, what I call like opportunities for change to like improve health.
Mm-hmm.
So I think at the root, that's one of the biggest public health problems, which we're working towards and trying to address, trying to do better with being a community driven and community responsive organization.
Yeah. Got plenty to keep you busy.
There's a lot of work to be done.
Yes, I
But it's
agree.
fun.
Yeah. Yeah. So let's shift a little bit. And I'm thinking about, that our listeners are pretty diverse, the folks that listen to and tune into the podcast. In your own words, how would you describe epidemiology, in the work that you do with the communities you serve? And the reason I'm asking this is because sometimes it's hard for people to move away from just the textbook definition, but really the grasping the applied definition. And I think this is a great question to ask on this one specifically with an organization that, Tribal Epidemiology Center, and you're really focused on that. So in your own words, how would you describe how, epidemiology is important in your work in the community that you serve?
So I guess epidemiology is super important. It's epidemiology is the science of public health, right? And public health is really, in my view, it's making sure that we're working towards that we're boosting everyone up to have the opportunity to live the healthiest life possible. And epidemiology is the science of how we do that, right? So I would frame it as a series of tools that help us facilitate an evidence-based conversation for how we can benefit communities or populations' health the most. And really at its core, like its fundamental core, that's asking questions and seeking evidence-based answers to those questions. So questions like, will this intervention be effective? Is this disease something I should be worried about? And if it is something I should be worried about, how can I create a system or intervention to, deal with that disease? So really epidemiology is about asking questions and seeking answers to benefit communities, right?
I like that. Yeah, I like that. It's really good. And that is, I love asking that question because I hear something different, from every person. And I really like the way you frame that. So, thinking about, we have a lot of, like I said, we have a diverse audience. So, we may have students of different levels, undergraduate, graduate, interested in public health. We have professionals from beginner, early career professionals, all the way through senior folks that are counting down to retirement. And we have entrepreneurs. We just have a variety of people listen to the podcast. We even have people that are from other industries that are curious about public health, and they're listening to these conversations because they want to better understand what we do and so forth. So, all of that being said, that's why I kind of ask a variety of these questions to kind of pull out information that I think my audience would be asking and wondering. So I kind of put myself in their shoes when I'm asking. But as we kind of begin to wrap up a little bit, do you have any advice or a tip for any current public health student or graduate who may be interested in a career in public health?
Yeah. Well, I guess two things. One is public health is fascinating, super diverse, and there's a lot of opportunities to explore your passion and really benefit communities and populations with getting to explore your passion. So I guess that's one thing. Public health is awesome. I'm biased, of course, but the other thing is be curious. Don't be judgmental when you get into public health. I think public health deals with a lot of challenges in a lot of different communities and populations, different types of people, and approaching that with curiosity, I think, is really beneficial. It helps us ask better questions. It helps us get to root causes of challenges more effectively, and it opens your eyes to new ways of interpreting, viewing, creating solutions that you may not have realized before, which I think is really beneficial and can help us ask better questions and then create better solutions for people, which is the root thing of what we want to do in public health. We want to benefit people, right? So approach things with curiosity.
I think that's great advice. And interestingly, I've heard that a few times as well, from guests in the past. So I really think it's important, it's good advice, and especially if you think about even your own story, your own journey and how you got to where you are. I mean, you were really following your passion, follow your past, the curiosity, you're seeking answers and you were exploring. And so that's really an important part of, really, I say, understanding public health, and making it your own. Like, what does this mean for you as an individual? And then being able to decide, what you want to do with it. It's not that there's a, a neatly laid out plan. I mean, 15 years ago, I had no idea I'd be right here. Heck, 5 years ago, I didn't know I'd be right here doing what I'm doing. So I think that, your advice of, following your passion and remaining curious is important. Well, thank you so much for taking some time and coming on the podcast to chat with me. I have a question I wasn't planning to ask you, but I'm going to ask you anyway. Since you started with, you were once pre-med and, you discovered this whole public health field and made the pivot. Looking back, are you happy you did, or do you have any regrets and wish you had gone a different direction?
I have any regrets? Wow.
Maybe
Um,
that's too loaded because I think we
uh,
all carry some regrets for some. But in the
I
context
progressed. Yeah, totally.
of your public health choice.
In the context of my public health, I mean, no, life is a journey, right? And I mean, every part of it is like an opportunity. Like I view as an opportunity to learn, and I think I think public health is really fascinating. I think it's really interesting to work behind the scenes, and I get to work on a lot of really interesting, like, a lot of really interesting opportunities to try and make the world a better place. And I don't really regret any of it. I think like each of it kind of contributed to, how I'm here now. So, I don't regret getting into public health. I think it's really interesting and fascinating. So I think more people should be in public health, because it's going to contribute to making the world a little bit better and healthier, thriving place. So yeah, I hope that answers that.
Yeah, yeah. I was just really curious since we were talking about
Yeah,
that from the beginning and even then chatting a little bit before we started recording, hearing your full story. I was just, curious if you're happy with the decision you made. So you definitely answered that question. So I
happy to be in
appreciate,
public health.
yes, I appreciate you for being here. And so thank you again for taking some time to sharing your journey and the work that you're doing at the Great Lakes. So yeah, my editor will take some of this jibber jabber out, but thank you for
I
being
appreciate
here.
that. Thank you. Thank you for giving me the opportunity to be here.
Awesome.
It's great talking to you.
Oh, likewise.